Hi everyone, I'm Dr. Larry Malerba and welcome back to the All Things Homeopathy channel. In this, the 34th episode of the Materia Medica series, I'll be talking about Apis mellifica. This homeopathic remedy is made from the whole live honeybee. It's an indispensable remedy used for many acute ailments and a good number of chronic conditions too. Okay, so let's jump right in.
All right. So the cool thing about Apis Mel is that it is one of the best examples of the doctrine of signatures that we have in the Materia Medica, which is to say that the physical or behavioral attributes of a plant, animal, or mineral can sometimes give us an indication of its uses for healing. In the case of Apis, both its symptom profile and therapeutic indications are almost a direct reflection of the bee itself and of its fascinating behaviors. While most remedies have only a symptom or two or three that correspond to the doctrine of signatures, Apis fits in many ways, both physically and emotionally. Now, the symptom pattern that runs throughout Apis can be summarized by the following: heat, redness, inflammation, burning, stinging, busyness, irritability, and most importantly, swelling. All of these symptoms are well known characteristics of the bee, especially an angry bee and the symptoms produced by its sting. And it's worth repeating, swelling is the most definitive Apis symptom of all, the one most important symptom that should alert us to the possibility of this remedy. Furthermore, swelling is directly related to another theme that runs throughout much of Apis's pathology, and that theme is fluid balance. As we'll see, a great deal of Apis symptomatology, swelling, edema, thirstlessness, and kidney and urinary tract dysfunction, has to do with fluid balance. But before we get to the physical aspects of Apis, let's first talk about the mentals. Okay, now, Apis is usually prescribed according to its physical symptoms. In most acute Apis cases, the mentals are usually not the reason why we choose this remedy. But when a person fits the type in general, or has a chronic condition that fits Apis, the mentals can often be quite helpful. So, with that said, on the mental emotional level, the Apis type tends to be strong and vital. They are active and have a busy intensity about them. One might even say busy like a bee. Many are task oriented and again like worker bees and may tend toward workaholism. They can also be restless, nervous, and fidgety. They tend to be no nonsense, practical types. Apis has been described as being forceful and direct. They are straightforward and not particularly introspective. The Apis type is very family oriented. They are protective of family and can be controlling within the family. But Apis is also irritable, excitable, and quick tempered, and can have sudden, intense outbursts of anger. Apis children can be whiny and hard to please. Like a bee protecting its hive, Apis can become aggressive, especially when crossed or betrayed or when defending a family member. Apis also tends to have a strong libido and lists prominently in the repertory under jealousy, especially jealousy between one female and another. Again, think of the anthropomorphized stereotype of the queen bee, who is suspicious and protective of her hive. The male drones mate with the queen, while the female worker bees perform many tasks in support of the hive. It makes sense, therefore, that Apis conditions can be aggravated by jealousy, rage, vexation, bad news, and sometimes even fright. And although Apis types are not particularly fearful, The few fears that they do have can include fear of death, fear of heart disease, and fear of being poisoned. Furthermore, the bee is not a solitary creature, so it also makes sense that Apis tends to desire company and can have a fear of being alone. Now, as we'll see, Apis can also fit medical conditions that affect the brain, conditions such as high fevers, headaches, meningitis, and hydrocephaly. In such cases, the mental state is often affected. The person may be absent-minded and confused, especially in cases of fever or delirium. There may be apathy or indifference during a fever, and sometimes we see depression with causeless weeping. One particular keynote indication for APIS is called cri encephalique, which translates into English as brain cry. Brain cry is a shrill, piercing scream that can occur when the brain is swollen, inflamed, or infected. This can happen with high fevers, delirium, head injuries, or any kind of insult to the brain. I once treated a case of brain cry. The child was confused and delirious with high fever after having been vaccinated just hours earlier. The high pitched screams were otherworldly and terrifying, like something you'd expect to hear in a horror film. A few doses of Apis in rapid succession brought the child quickly out of danger, as his fever dropped and he regained full consciousness. There were no sequelae in the following weeks and months. Rubrics with this type of brain symptomatology that list Apis prominently include delirium during fever, delirium in meningitis, delirium with shrieking, delirium with muttering, muttering to himself during fever, stupefied during fever, unconscious during fever, indifference during fever, says he is well when very sick, says he is well in delirium, shrieking brain cry, shrieking piercing, shrieking during convulsions, shrieking in hydrocephalus, shrieking in meningitis, sudden paroxysmal shrieking in children, and shrieking with boring of the head into the pillow. Okay, now let's talk about the Apis generals and modalities. All right, now, so generally speaking, although some Apis types can be chilly, by far most tend to be warm-blooded, and they're distinctly aggravated by all forms of heat and ameliorated by all forms of cold. They're aggravated by a warm room, aggravated by warm drinks, and aggravated by warm applications. Conversely, they're ameliorated by cool air, ameliorated by cold drinks, and ameliorated by cold applications. Sometimes there are flushes of heat with redness of the face. And generally speaking, Apis is right-sided. It fits right-sided headaches, right-sided sore throats, right-sided ovarian cysts, and right-sided swollen testicles. Apis symptoms can also move from right to left. And as we would expect, most Apis pains are stinging pains. Some describe them as pricking or burning pains. Another very strong keynote general is Apis's tendency toward fluid retention and swelling. When we see swelling or edema anywhere in the body, externally or internally, we immediately think of Apis. If I listed all the Apis rubrics in the repertory that fit dropsy, edema, or swelling, This episode would drag on for far too long. Another strong APIS keynote general is thirstlessness. Most APIS conditions are accompanied by a lack of thirst. So when we see the combination of thirstlessness and fluid retention, we must think of APIS. One notable exception is that we occasionally see thirstiness during fever or during chill. And the only notable food and drink preference of APIS is a desire for cold drinks, especially cold milk. Now, some additional APIS modalities include a time aggravation of 3 or 4 p.m. or from 3 to 4 p.m. Fever or chills may act up around this time. There can also be an aggravation of symptoms from touch. APIS is also aggravated by suppressed skin eruptions and can be aggravated by suppression of the libido. And lastly, APIS symptoms can be aggravated before or during the menses. Now think again about the image of an angry bee whose bite stings and burns and gets red and swollen and is irritated when touched. It is aggravated by heat and welcomes a cold compress. And as the bitten part swells and retains fluid, it's balanced off by an overall decrease in level of thirst. Now, I'm not saying that this is always true with all bites. It's just a convenient device by which to remember the APIS symptom pattern. These are the primary features that we tend to see in most APIS physical ailments. Think of an insect bite as a type of allergic reaction. APIS is the number one remedy for sudden, acute allergic reactions that involve inflammation and swelling. It can fit not just bee stings, but insect stings in general. It fits all kinds of allergic reactions that result in inflammation, itching, hives, and swelling. Although I wouldn't rely on APIS as the sole method of treatment, it is the number one remedy for anaphylactic reactions. For individuals who have a history of such reactions, it's always wise to have additional help available, such as an EpiPen injection. When an allergic reaction causes swelling of the face, lips, throat, tongue, or larynx, APIS is the remedy of choice. Likewise, we think of APIS in chronic cases of angioedema, where there's swelling of the face, especially around the eyes. And it's the same basic pattern when we see a swollen right-sided sore throat that stings and feels better from cold drinks, and a uvula so swollen that it seems like it could burst should also make us think of APIS. APIS fits swelling of the mucous membranes, which are moist surfaces that are open to the exterior of the body. This includes the membranes of the eyes, nose, mouth, respiratory tract, digestive tract, and urinary tract. APIS also fits swelling of the serous membranes, which are internal membranes that surround and protect internal structures like joints, the brain, the heart, lungs, kidneys, and so on. So, a swollen right sided ovarian cyst that feels like it could burst should remind us of APIS, or an inflamed, hot, red, visibly swollen joint. As noted earlier, internal swelling of the brain could cause mental symptoms like brain cry, rolling of the head back and forth, or boring of the head into the pillow. One more related keynote APIS symptom is awkwardness of the hands that results in a tendency to drop things. Additional conditions that may respond well to APIS include conjunctivitis, tonsillitis, and otitis, appendicitis, peritonitis, cellulitis and swollen, painful hemorrhoids, pneumonia and pleurisy with pains or cough that are worse on inspiration, water retention associated with the menses, a tendency toward miscarriage, especially in the early months of pregnancy, toxemia of pregnancy or preeclampsia with high blood pressure and excess protein in the urine. The kidneys are the main organs that regulate fluid balance in the body, and APIS can fit a wide array of kidney and urinary tract conditions like nephritis, glomerulonephritis, and cystitis. APIS is a main remedy for nephrotic syndrome, which is characterized by water retention and excess loss of protein into the urine. APIS is also indicated in cases of urinary retention with little or no urine production, especially in newborns, pregnant mothers, during and after labor and delivery, after surgeries, and after use of a catheter. APIS lists prominently under many kidney and bladder rubrics in the repertory. The following are just a sampling of those rubrics: bladder inflammation, burning bladder pain, retention of urine in newborns, constant urging to urinate, inflammation of the kidneys, kidney inflammation with edema, suppression of urine, general swelling with kidney complaints, protein in the urine, swelling lower limbs with albuminous urine, and general swelling of the body with albuminuria. Now, lastly, of course, APIS is an important remedy for hives and hive-like eruptions. Recall that the homeopathic books refer to hives as urticaria. Apis hives can be large or small and may look red or white. They may itch, burn, or sting, and are aggravated by warmth and ameliorated by cold. I once treated a woman who consulted me for her chronic Lyme disease. The entire surface of her body was puffy and red. She looked like one big welt. She was horribly aggravated by the slightest bit of warmth, and she was very irritable. She was not happy, and she made it known to me in no uncertain terms. Luckily, periodic doses of Apis did the trick. With each return visit, she was a little less red and puffy, and her demeanor became increasingly pleasant. Now, Apis can also be indicated for a variety of additional skin conditions, including abscesses, boils, eczema, chickenpox, and measles. It can also come in handy for suppressed skin eruptions and suppressed exanthematic fevers. And lastly, Apis can also fit cases of herpes and even shingles. I once treated a case of shingles in a woman who appeared to be grieving. I thought that she needed Nat Mure, but the shingles symptoms made me think otherwise. The eruptions ran down her right arm and were very painful. There was much stinging and burning, and she relied on cold packs for relief. I asked her if anything had happened to her prior to the onset of her shingles, but she wasn't able to identify any particular event. Knowing that Nat Mure and Apis are complements, I decided to give Apis. The pain and eruptions subsided rapidly, but the fascinating thing was the way in which it all happened. The patient reported that within hours after taking Apis, she exploded into a rage that she directed at her husband. The rage was quickly followed by a meltdown into crying. In the midst of her tears, she suddenly remembered the reason for all of her distress. Several weeks earlier, she had become very upset about the results of an election. The candidate that she supported had lost, and as a result, she had become angry and distraught. Within minutes of this realization, her arm pain began to subside and the eruption started to fade. I've never forgotten that case, which has forever impressed upon me the powerful connection between mind and body. Okay, now it's time for remedy relationships. All right, so there's one well known complement to Apis, and that remedy is Natrum muriaticum. The two have a very strong relationship to each other. Natmir types have a tendency to develop Apis acutes. By the way, Bryonia is also an important acute complement to Natmur. The main point of overlap between Apis and Natmur is that they're both warm-blooded and both tend to develop hives that are aggravated by warmth. Remedies that we want to compare to Apis include Urtica urens, which is a remedy made from the stinging nettle plant. It fits burning pains, stinging pains, swelling of parts, allergic reactions, insect stings, and urticaria. Think of urtica as the plant kingdom's counterpart to the animal kingdom's apis. Pulsatilla is also warm-blooded, thirstless, aggravated by warmth, ameliorated by cool air, fits urticaria aggravated by heat, and is indicated for a lot of acute ailments. Belladonna has a similar vitality and strength, has right-sided symptoms, is aggravated at 3 p.m., and has a lot of heat, inflammation, and redness. The main difference is that while belladonna has more fever, apis has more swelling. Ledum has swelling and inflammation and is ameliorated by cold applications. And while apis fits acute reactions to bites and stings, ledum is a remedy used to prevent the longer term constitutional effects of bites and stings. Lycopodium is right sided, has symptoms that move right to left, and symptoms that are aggravated at 4 p.m. Hellebris is a remedy for brain swelling, meningitis, hydrocephaly, mental dullness and confusion, has awkwardness of the limbs, rolling of the head, and is aggravated at 4 p.m. Bovista has puffiness and edema, fits urticaria and allergic reactions, and is the other main remedy that fits awkwardness of the hands with a tendency to drop things. Apocyinum fits serious kidney conditions associated with urinary retention and a great deal of edema and internal fluid retention. It has been referred to as the chilly apis because it is worse from cold and better from warmth. And lastly, Cantharis, which fits tremendous burning pains, painful burning skin eruptions, can be better from cold applications, has a strong libido, and fits a wide variety of urinary tract infections, including both kidney and bladder infections. Okay, there you have it. Apis mellifica in a nutshell. Thanks very much for watching. Please be sure to subscribe and don't forget to tell your homeopathic friends and allies about the All Things Homeopathy channel. May the vital force be with you.